So here we are again, another wonderful ZOOMERTIMES interview. And I have the best doctor, Dr. Mohsin Jaffer, who is really the founder of the Senior Medical Associates. And, you know, Dr. Jaffer, when you first started, I think we once talked about this, you started, I think, in one location in Broward County, and then what happened? Why the explosion of all the offices that you have?
Hi, Anita. Hi to all your listeners and your viewers. I don't consider myself as the best doctor. It's the team. You see, it's usually the doctor, his staff, even the front desk person contributes.
There's the team,
well,
right.
That's right. So it's our team. We've got a very good team. And how this team built up from one practice was that we were doing very well. And then the insurance company said that all the different companies, that your patients do very well. These are seniors, but they are moving more. More of them are going to the gym. More of them are staying well, because insurance company and the patient's wishes are basically same, is to keep the patient as healthy as possible. And I, as a patient, or you as a patient, want a doctor to help you stay that way. You're not interested in all these operations or expensive medications or treatments. You rather have your own body functioning as best as possible with health and wellness. And this is what we were practicing. And they felt that we should expand our operations, and we did. And today we have 10 offices with all our doctors subscribing to the same philosophy. Every member of our staff subscribes to that philosophy, where the patient comes first. How do we help him or her stay healthy and well?
I know.
And the philosophy that has prevailed.
It's always right. That's when I first met you, and I remember that you talked like that. And that's a little unusual nowadays. I guess you have to do some very good interviews to make sure the doctors that you get feel that way, because not all doctors do.
That's a good thing. That's why we have a meet and greet. So when a new patient comes on, we bring them in, make them comfortable with the office, all the staff in the office, the environment, and the doctor, so they have an idea of what new practice they are joining and what to expect. And we also tell them what to expect, because we put them on a pedestal where we say, look, you're the captain and you're on the ship, but we are your navigators. Allow us to come aboard, help you and guide you, keep you healthy and well for as long as the good Lord gives us life.
Yep, you are a unique individual, and it's a pleasure. I wish we could clone you. I've told you that so many times. And so, had you ever considered coming up into Palm Beach County?
Well, we have a lot of doctors in Palm Beach County, you're right, but our own offices are in Broward County.
Yes, I know.
We may do that. As time goes by, we may just do that. We have got a lot of requests to do that, and we are considering that maybe next year.
Well, good. I'll help you in any way I can, because I like our population to be served people like you. And now, the one thing that I asked Dr. Jaffer before we got on the show was, has he seen any patients who had COVID? And if he would explain it to us. Everybody's so worried about it. Tell us from the very beginning what happened, will you?
You know, we only take care of seniors, 65 and above. And I want to appeal to all these seniors that you should consider yourself a very special generation. You have been the main generation that made America prosperous and America what it is today. So you have earned the right to the best healthcare you can get, or you definitely deserve. So when this pandemic hit, you know, after January, we found out that it's coming across to America. We were in fact proactive, and we told our patients to stay at home, because we found out, especially in those days, right away, that the most susceptible people were the seniors. If a senior got COVID, he or she was more likely to succumb, or at least get a very severe bout of the disease. And we didn't want our seniors to do that. So we told them to stay at home, to quarantine themselves, to do the social distancing, to wear a mask. And I'm glad we did that, because our ratio of COVID patients is much less than the county average. So that's one good thing. But some of our patients did get COVID from family members, from people visiting them, or for themselves going out without the adequate precautions. And they did get COVID. And we've had some who succumbed. But a lot of them have come home. We had a 104-year-old patient who just came home and survived, in Broward County. So this disease definitely affects people whose immune system is not up to par. So those who have had multiple comorbidities and other diseases, diabetes, high blood pressure, obesity, and cardiovascular disease, those people have been affected badly because they succumb to the ravages of the virus.
So let's take it back a little bit though. Somebody, how did they know that they had something that was different? They called you. What did they say when they called your offices?
You see, we started preemptively calling them every week to tell them, look, we are here for you. We understand what's happening. You're isolated. You're at home, but make sure your medicines are refilled. Make sure all your needs are met. So we had open conversation on the phone, telemedicine. So we had the connection. So the patients never lost that touch with their own personal doctor. So that gave them confidence to weather the storm if, God forbid, they got COVID. And they called us, and a lot of them didn't have to go to the hospital because they were suffering from a mild case. And we told them all the signs and symptoms they should be aware of to go to the hospital right away in case their situation was worsening. And some of them did go to the hospital. Many of them survived and did well and are back home again. Very few succumbed. So that's our story of COVID with our patients.
Okay, so pursuing this. So do people start out with a fever, or what do they start out with basically?
It's multiple symptoms, from fever to even diarrhea and headaches. And then you start feeling that you get the virus syndrome, your body ache, the whole body aches. And then the serious part is this may just last a few days and you're over with. 50% of COVID patients don't even get a symptom, especially the younger ones. So these are the ones who are spreading. They've got the disease, but they're spreading it without being aware that they are victims of COVID and they should be wearing a mask. Let me give you one very, very strong argument for the mask. When COVID started happening in China, one Chinese American was coming back to America. And on the plane, he had the symptoms of COVID. And he was coughing and he was sick. And when he landed, he had to go to the hospital. And the CDC was 100% sure that probably everybody on that plane will get COVID. Not even one person got COVID. You know why?
Why?
This man luckily was wearing a mask. So the mask prevented him from giving the virus to everybody on that plane, including the air hostess who served him so much and took care of him. She didn't get COVID because of the mask. So I want to, if anything we can take away from today's talk, mask, mask, mask. Mask will prevent you, if you have COVID, from giving anybody else, and it will prevent others from giving us. And recently, CDC made an announcement, which I am quite intrigued with, that wearing a mask may be as good as getting a vaccine. Now, let me explain. So you see, the idea of this COVID virus, the particles of this virus hitting you, if a large number of virus particles enters your mouth or your nose or your mucous membrane through your eye, they will settle in and multiply and grow in your body and finally take over your body. But very few land on your nose or your mouth. Your body may just look at it as a small invasion, mount a response, and kill those virus and almost have a vaccination, you see, and have no symptoms. So having a mask will reduce the chances of big quantity of virus hitting you. And this is a very good way to perhaps even get immunity against this infection. That's what the CDC was trying to say.
That's excellent. No one has ever talked to us enough about this. I'm glad you're doing that. So, but we don't cover our eyes. We just cover our nose and our mouth. Should we be covering our eyes in some way with that plastic?
Clear glasses is good. Wearing a shield is a very good idea. And also the other ways you can put it is by touching your eyes and nose and so on, because you might touch surfaces that have got the virus on it and you give it to yourself.
And another question is, our ears are open. Are they not affected?
Luckily, ears are very well equipped. You see, you've got the cerumen, the wax. It, stops all the bugs and everything coming in. It's antiseptic and it's good. So ear has not been a great point of entry for virus to attack your body. It's mainly the mouth, nose, and eyes, the conjunctiva of the eyes.
Okay, so talk to us about washing our hands also.
You see, the virus is covered with a fat layer and it's got protein inside and the RNA. So soap is the greatest killer of oils. You got oily hands, you wash with soap and your hands are nice and clean. So the best way to kill the virus is to wash your hands with ordinary soap. Soap just kills the virus because it dissolves the virus, literally dissolves the fat layer of the virus. So the soap is your best friend. Wash frequently. A lot of people said, oh, I don't like it, my hands get too dry. Use a skin cream, after you're washing your hands, use a nice skin cream to make your hands moist again, to the moisture in your skin. Especially seniors have got dry skin, so they are averse to washing their hands frequently. But now in the days of COVID, please leave aside your shyness and use the soap and then have a nice moisturizer cream so that you don't feel dry hands.
My guest, this is such a wonderful thing, and I know when Dr. Mohsin Jaffer comes on, and he is the founder of the Senior Medical Associates, let me give you phone number and also the way that you can get in touch with them through their website. It's 954-659-9690. I'll do that again. It's 954-659-9690. And the website, seniormedicalassociates.net, all one word, seniormedicalassociates.net. And they are all over Coconut Creek, Coral Springs, Deerfield Beach, Hollywood, Pembroke Pines, Plantation, Oakland Park, Sunrise, Tamarack, and Weston. And they speak many different languages. So even if you have a doctor, they're great for second opinions, but if you don't have a doctor, you definitely should go there. Even if you live in another county, it's worth it. You don't go to the doctor that often. And I can't tell you how incredible they are as a primary physicians. And with Dr. Jaffer being the head of it, he really takes care of people so well. So Dr. Jaffer, when we talk about washing our hands, when we see movies or we see TV shows of doctors going into operations or when they're in your office, they always wash their hands. What are they washing for? That's before COVID.
We are so blessed in having a skin. The skin is one of the greatest barriers for bacteria and the viruses from entering your body. But when you breach the skin, you're giving access to all these bad pathogens to enter your bloodstream. And once they are in the bloodstream through the skin, then they can go anywhere because the blood goes everywhere. All the 30 trillion cells we have need blood, and the virus or the bacteria in the blood could go everywhere. So if a surgeon is operating on you, they sterilize your skin very well, they sterilize their hands, they wear sterile gloves, they cover their mouths and don't breathe on the wound, so they would not put their own bacteria or virus in the wound. So it's sterile surgery. And you don't want your surgeon infecting you, You cut out your gallbladder but give you an infection, you don't want that. So that is the reason why they wash their hands. But we have learned from them that by washing hands, you really get sterile hands. In fact, if you look at the surgeon washing his or her hands, it's ordinary tap water. It's soap and ordinary tap water. This is not special water. But just the fact that they use the soap literally sterilizes your hand. And that's why we like the idea of hand washing in this COVID pandemic, that you eradicate all the viruses. And I don't know if I told you last time that 1 liter of seawater has got 100 million viruses. And one pound of soil has got 1 trillion viruses, different viruses. It's just we are unlucky that we have this virus that jumped from bats to come to humans, and now we don't have a defense, just like HIV or Ebola or SARS and all these viruses that have jumped from other animals to us, and we feel unable to deal with them.
Well, I just had my flu shot. Are you encouraging all your patients to come and get their flu shots?
That's a very good point. Flu shot is a very good idea, because what does a flu shot do? It teaches your body to say, look, if this virus, its protein or its DNA or whatever is the component of that virus comes into your body, it trains your immune system to recognize the threat and to mount a defense and an offense, and get ready that if tomorrow you get the real big chunk of virus coming in, the influenza virus, your body will fight it. But also it has got the other effect of boosting your immune system. Because let's say there's a small war going on, you're getting ready to fight this war, but your soldiers are prepared for another war, you see?
Mm-hmm.
So you're preparing the soldiers of your body, and that's your immune system, your T cells, your antibody production, your ability to mount a defense and an offense is what is your immune system about. And we have been created, it's such a wonderful machine, this human body, that our patients should never forget how beautiful it is, not take it for granted. You know, we just, as we get older, we become so oblivious of how well this body has served us. You know, I tell my patients, you buy your Mercedes or Cadillac, but in 20 years, it's made of steel, but in 20 years, it's junk. But your body has got a capacity today to live up to 120 years. If
Yes.
only you take good care of it.
Yes, I'm going to see you there.
So I want your patients to stop sitting around and only watch TV, only sit. If they've done 5 minutes of walking, they come and sit down, they can watch 15 minutes of TV, then get up again and walk. Because this is another way, besides your flu shot, to boost your immune system. Get your blood rushing around. Like I tell all my patients that the best doctor you have is you. But who does the work in your body? It's your blood. Because it has to supply every cell with nutrition and defense and take away the waste products. That's what the blood does. But if your blood is circulating around very actively, then you augment your immune system and you augment your ability to fight any disease and stay free and clear of all the waste products. And your body and your cells are not inundated, so they feel less able to fight the virus that came in and takes over the cell to multiply. That's how the virus does. It's a particle. It's not even a live thing. They call it a virus particle. But once it enters your cell, it takes away the nuclear material of your cell, makes it a factory, and starts producing thousands of copies of the virus particle. And then the cell bursts and it goes into your bloodstream and more cells are invaded. That's how your body finally succumbs.
I love how you talk. I could listen to you all the time. Sometimes I listen to some of your YouTubes that you didn't do with us. You really are a charmer and you're so smart. And before I make your ego too high, I want to talk about the pneumonia shot. I just had that also. Now, shouldn't everyone be getting that? And you only have to have it, I think, once every 10 years or something.
Pneumonia shot, you see, in the olden days, before antibiotics, most people died in their 40s. Even in America, 100 years ago, life expectancy was around 40. Thanks to antibiotics, we now live long enough that today, a girl born today will live to be 80 and a boy 78. Boys have got less. So why is that so? Mainly because we conquered pneumonia. Pneumonia was the biggest killer as you got older. If you got a cold or a upper respiratory infection, but you didn't handle it well, or your body didn't handle it well, it went down your windpipe and it went into your lungs and took over your lungs. And in a fight, your body drowned, produced so much fluid, you drowned, and that's the pneumonia. Pneumonia is what? It's the product of all this fighting, the liquid, the dead bacteria, the dead cells, and it clogs your lungs. You can't even breathe. You're literally dying from not being able to breathe. And that used to kill people so much that the average life expectancy was only in the 40s. Thanks to antibiotics, we've done that. So now we know which bacteria cause pneumonia. So if we can educate your body to know this bacteria, how to recognize it, and God forbid this bacteria comes into your body, you can fight it. You see? Same thing like I talked about the flu vaccine. You're just teaching your body to be able to handle this. And for seniors, the biggest killer has been pneumonia. So why not take a pneumonia shot?
No, I of course have always had them. I believe in all that, but tell me why there are people that say, I never take those shots because it gives it to me. I have someone say, well, I took a flu shot, the next day I got the flu. What is all that about? Is that just...
See, this is a fallacy because flu shot cannot give you flu, okay? Right. It's not giving you the infection. It's only teaching your body that if you had flu, how would you respond? So some people respond very, very vigorously. They get a body ache, they get a fever, their arm aches, and they don't feel very good for a couple of days. So I would tell my patients, if you get a flu shot, take a couple of Tylenol, at least your reaction would be subdued. You won't get the body ache and the headache and the arm ache. But this small flu-like reaction is okay. It's just teaching your body. And in fact, you should be glad that you only got that, because if you get the real flu, you might be in bed for 3 weeks or 4 weeks. And you know, in America, every year we get the flu. We got the vaccine, we got the treatment. Still, 20 to 30,000 people die every year in America because of the flu.
And they didn't have a flu vaccine, the ones that die, right?
Well, it's not 100% effective, so small percentage are not, but they were overwhelmed and their body couldn't mount the right response. And most of them didn't have a flu shot. So even with a vaccine, we've got a formidable enemy. That's why when it comes to COVID, we should be even more vigilant, because this guy, we don't have a vaccine, we don't have a credible treatment yet. We are working on many alternatives, which are showing promise, but we are not there yet. And hopefully by the end of this year, we might have a vaccine. But by the time we get the vaccine, first of all, you want to only take the vaccine that is approved by CDC. I would not put faith on other vaccines, because our CDC is one of the best organizations in the world. I would trust them more. Like there are other countries that are making it, fast-tracking their vaccines. We don't know for sure how effective they are. I would take that with a grain of salt. So when that happens, probably next year you'll get the vaccine. Right. Until then, please take care now.
All right, and now I'm going to do something on the lighter side. I have found that very high quality honey is really good for you. Tell us about your opinion, because I know that you come from, when you're not born in the United States, a lot of the good things that you bring here from the older countries are good, and honey and some of the ideas that you bring, turmeric and all, really work.
I'm from Africa. I also have some Indian heritage. So a mixture of that gives you exposure to the Orient. And what in Africa, honey is a great gift, you know. But let me tell you something about honey. It's a remarkable food. The honeybee makes this from the nectar, from the flowers. But the beauty of this product is that they found it in the Egyptian mummies, and in the Egyptian tombs where they provided everything for the king for afterlife. And they found jars of honey thousands of years later, and yet they didn't have any fungus, no bacteria. You could still eat the honey and it was still good. So this tells you how good a product this is, because honey has got antibiotic properties, antifungal properties, and it's a great nutrition. It's a great sugar also. So instead of sugar, if you use honey, I think is the smartest thing to do. If, like you had some time ago, you had a sore throat,
yes,
you took honey and lemon. It works great.
Right.
Honey can be honey and apple cider vinegar is a great way to reduce appetite, so you don't eat so much and lose some weight, hopefully. So honey has got a lot of uses. You can look it up today. Mr. Google is a great doctor, but take it with a pinch of salt. I tell my seniors, look up things, but verify with National Institute of Health or the reliable websites. But honey truly is a great food.
Yeah, and I've been doing that a lot. I think you're right. And if you want something sweet, you can just have a spoon of honey. And also I think I read where if you have a sore, you can put some honey on it and it heals it. Is that true?
That has been used for centuries. You see, when you have a sore, its bacteria is coming in, attacking your cells, not allowing the blood flow and the fibrocytes to slowly heal the wound. You got a wound and you want to heal it. So this is impaired. But if you put honey, it provides you a hydrostatic barrier. It sucks all the water away from the bacteria, so they all desiccate, and it gives your body a chance to heal. And we have found it works even today. In medicine, sometimes we have indolent ulcers. We'll use honey and just put a muslin cloth over it and wrap it up, and lo and behold, these wounds heal well.
There's nothing there's nothing I can say to you or ask you that you don't know. Do you?
I know.
You know everything.
You're very generous, but the more we learn, the more we realize how little we know.
Yeah.
So, and it makes us humble, because there is so much to know. There's so much to learn. And I would strongly implore all your viewers to realize not to stop learning, not to stop expanding their mind, because we used to think the brain is static. It improves, it expands, it's plastic, just like all the other cells. Like I tell my patients, don't feel you've got an old body. Your body is not old. He said, what do you mean? I'm 70 years old. I said, look, you may be 70 years old chronologically, but your skin is only 1 month old. Your blood changed in 3 months. And even the bones remodeled in 2 years. So you are literally a new person every day. You are rejuvenated.
Oh, that's fabulous news. You see how you put that?
1 minute.
So I tell all my patients, do not despair. You're only old when you're dead. Until then, you have to think young, you've got to act young, and you'll be surprised how young your body can become. Even if you got arthritis, you start walking, you force yourself, very soon you're walking without a walker or a stick. And you'll be surprised. You just have to push these people, or themselves have to believe. You have to believe that you have this potential.
Yes.
And by not doing all these things, you are thwarting your own potential to be vibrant, healthy, and full of vim and vitality and vigor.
Well, it's all to do with attitude also.
Yes.
You have a great attitude, and you'll find it that people who have excellent attitudes do very well, and that's what you do have. Are your children like you? I know your son, Muhammad. I don't know your other son, but have you imparted? Do you have any daughters?
Yes, I have. My oldest child is a daughter. She's an architect, but she's helped us design our offices. That's why your patients should take a virtual tour on our stallionmedical.net, and they'll have a virtual tour of every office. She designed all these offices. We made them open access.
One thing I have to tell you is we're going to shut down because we're just about out of time. So Dr. Jaffer, thank you. I'm always so grateful when you come on, And we will look forward to having you again, and just be well and keep smiling. And I learned so much from you.
Thank you, and God bless all.
Thank you, Dr. Jaffer. Goodbye.